Diarrhea is a common digestive problem. It makes you poop more often. Your poop may be loose and watery. Diarrhea can be uncomfortable, but it often goes away on its own. Diarrhea is a very common problem. Most people get it a few times a year. It can last a day or two. Sometimes diarrhea can last longer. This may mean you have a more serious problem. If you are worried about your diarrhea, talk to your doctor. There are many things that can cause diarrhea. Viruses are a common culprit. The stomach flu, for instance, often leads to diarrhea. Bacteria are another common cause. These harmful bacteria can sneak into our food or water, leading to an upset stomach and diarrhea. Sometimes certain foods can trigger diarrhea. Foods that are high in fat or sugar can be difficult to digest, leading to digestive upset. In some cases, underlying medical conditions can cause chronic diarrhea. Conditions like irritable bowel syndrome or Crohn's disease can affect the digestive system and lead to persistent diarrhea. When diarrhea strikes, there are several things you can do at home to find relief. One of the most effective remedies is to increase your fluid intake. When you have diarrhea, your body loses fluids and electrolytes. It's crucial to replenish these lost fluids to prevent dehydration. Water is essential, of course, but you can also sip on clear broths, sports drinks, or oral rehydration solutions. Another helpful home remedy is to get plenty of rest. Your body needs time to rest and recover when you're dealing with diarrhea. Staying hydrated is crucial when you have diarrhea. As mentioned earlier, diarrhea can lead to dehydration, which can be dangerous if left untreated. Dehydration occurs when your body loses more fluids than it takes in. This can happen quickly, especially in young children and older adults. The early signs of dehydration include thirst, dry mouth, decreased urination, and fatigue. In more severe cases, dehydration can lead to dizziness, confusion, and rapid heartbeat. Section 5. Food as Medicine Dietary Recommendations. When dealing with digestive issues, particularly diarrhea, the food you consume can play a crucial role in your recovery. When you're experiencing diarrhea, it's important to pay attention to what you eat. Your diet can either help alleviate your symptoms or make them worse. Certain foods can aggravate diarrhea, while others can help soothe your digestive system. For instance, foods high in fiber, fat, or spices can irritate your digestive tract, whereas bland, low-fiber foods can be more gentle on your stomach. The brat diet is a well-known dietary approach for diarrhea. This diet is often recommended because it includes foods that are easy to digest and can help firm up your stools. BRAT stands for bananas, rice, applesauce, and toast. These foods are not only bland, but also provide essential nutrients without putting too much strain on your digestive system. These foods are bland and easy to digest, which can be helpful when your stomach is upset. They can help reduce the frequency of diarrhea and provide some much-needed energy. In addition to the brat diet, other foods that may be helpful include cooked carrots, potatoes, and chicken. These foods are also easy to digest and can provide additional nutrients that your body needs to recover. It's best to avoid fatty, greasy, or spicy foods, as these can worsen diarrhea. Foods that are high in fat can be difficult to digest and may increase the severity of your symptoms. Similarly, spicy foods can irritate your digestive tract and should be avoided until you feel better. Staying hydrated is also crucial when you have diarrhea. Drinking clear fluids like water, broth, and herbal tea can help replenish lost fluids and prevent dehydration. Eating small, frequent meals instead of large ones can also be beneficial. This approach can help your digestive system process food more easily and reduce the likelihood of further irritation. As you start to feel better, you can gradually reintroduce more regular foods into your diet. However, it's important to do this slowly to ensure that your digestive system can handle the change. If your symptoms persist or worsen, it's always a good idea to consult a healthcare professional. They can provide personalized advice and ensure that there are no underlying issues that need to be addressed. By paying attention to your diet and making thoughtful food choices, you can help your body recover more quickly and get back to feeling your best. Section 6. Navigating over-the-counter relief. In addition to home remedies and dietary changes, several over-the-counter medications can help relieve diarrhea. Loperamide, also known as Imodium, is a common over-the-counter medication that slows down bowel movements. Bismuth subsalicylate, also known as Pepto-Bismol, is another option. It works by reducing inflammation in the gut and killing bacteria that may be causing the diarrhea. It's important to note that over-the-counter medications are not suitable for everyone. If you have a fever, bloody diarrhea, or severe abdominal pain, it's crucial to consult with a doctor before taking any medication. Section 7. When to worry. Recognizing severe symptoms. While diarrhea is usually not serious, there are times when it's essential to seek medical attention. Understanding when to worry can make a significant difference in your health and well-being. If your diarrhea lasts longer than 2 days, it's important to see your doctor. Persistent symptoms can be a sign that something more serious is going on in your body. Additionally, if you experience any of the following symptoms, seek medical help immediately. A high fever, blood in your stool, severe abdominal pain, or any other unusual symptoms that cause you concern. Signs of dehydration, such as dizziness, confusion, or a rapid heartbeat, are also red flags. Dehydration can quickly become a serious issue, especially if not addressed promptly. If your diarrhea doesn't improve after 2 days of home treatment, it's crucial to consult a healthcare professional. Over-the-counter medications may not always be effective, and professional guidance is necessary. These symptoms could indicate a more serious underlying condition that requires prompt medical attention. Conditions such as infections, inflammatory bowel disease, or other gastrointestinal disorders may be the cause. Keeping track of your symptoms and their duration can help your doctor diagnose the issue more accurately. Don't hesitate to seek help if you feel something is wrong. Remember, it's always better to be safe and get checked out by a professional. Your health is paramount, and early intervention can prevent complications. By recognizing severe symptoms early and seeking timely medical attention, you can ensure better outcomes and peace of mind. Stay informed and proactive about your health. Section 8. Children and diarrhea. A note of caution. Diarrhea in children, especially young children, can be particularly concerning. Children are more susceptible to dehydration from diarrhea, so it's crucial to monitor their fluid intake closely. If your child has diarrhea, offer them plenty of fluids, such as oral rehydration solutions, water, or diluted juice. Avoid giving them sugary drinks, as these can worsen diarrhea. As with adults, if your child's diarrhea is accompanied by a high fever, blood in their stool, severe abdominal pain, or signs of dehydration, seek medical attention immediately. Section 9. Traveling smart. Preventing travelers' diarrhea. Travelers' diarrhea is a common problem for people traveling to developing countries. It's usually caused by consuming contaminated food or water. To reduce your risk of travelers' diarrhea, be cautious about what you eat and drink. Stick to bottled water, avoid ice in your drinks, and make sure your food is thoroughly cooked. Washing your hands frequently with soap and water is also essential, especially before eating and after using the restroom. Section 10. The importance of hygiene. Maintaining good hygiene is crucial for preventing the spread of diarrhea-causing germs. Wash your hands thoroughly with soap and water after using the restroom, before preparing food, and after changing diapers. If you're caring for someone with diarrhea, be sure to wash your hands frequently as well. Disinfect surfaces that may have come into contact with diarrhea, such as toilets, sinks, and doorknobs. Section 11. Finding relief. A recap and reassurance. In this section, we will revisit some key points and offer reassurance for those dealing with digestive discomfort. Diarrhea is a common digestive ailment that can be uncomfortable, but usually resolves on its own within a few days. It can be caused by various factors, including infections, certain foods, or even stress. Understanding the root cause can help in managing the symptoms more effectively. Staying hydrated is crucial, so drink plenty of fluids like water, clear broths, or oral rehydration solutions. Dehydration can worsen the symptoms and prolong recovery, so it's important to replenish lost fluids and electrolytes. Coconut water and sports drinks can also be beneficial. The brat diet, which includes bananas, rice, applesauce, and toast, can provide relief by being gentle on the stomach. Over-the-counter medications like loperamide or bismuth subsalicylate may help reduce the frequency of diarrhea and provide comfort. However, it's important to use these medications as directed and consult a healthcare provider if unsure. However, if your diarrhea is severe or doesn't improve after a few days, it's essential to seek medical attention. Persistent diarrhea can lead to complications such as severe dehydration or indicate a more serious underlying condition that requires professional care. By following these tips and taking care of yourself, you can effectively manage diarrhea and find relief from its symptoms. Rest is also important, as it allows your body to heal. Avoiding caffeine, alcohol, and fatty foods can prevent further irritation of your digestive system. Remember, if you have any concerns, don't hesitate to reach out to your doctor. They can provide personalized advice and treatment options tailored to your specific situation. Keeping a symptom diary can also be helpful when discussing your condition with a healthcare professional.